it's actually pretty interesting because, like you said, there's a lot of rural regions and very few providers. Yeah. Credentialing timelines suddenly become a little bit more than compliance. And now that I'm also in a rural area here in Georgia, you can really tell how credentialing sometimes gets not treated the same. And then not only that, there's a limited access to care. So in rural areas, you got to depend a lot on telehealth. And I'm talking all kinds of telehealth. You got to depend on nephrology, cardiology, endocrinology, all those ologies. You have to depend on telehealth. So it's pretty interesting, and the access to care is really limited in rural areas.
Exactly. The nearest specialist, is 2 to 3 hours away from some people. And a delay in privileging or credentialing could really literally mean community loses access to providers. So I would imagine that the credentialing out of Idaho has to just really be spot on. And if it's not, boo, call AQC. We got you. I'm just saying.
Well, exactly. So, that's why we have to really dig into Idaho, see what's happening behind the scenes and why credentialing professionals are really under enormous pressure to keep things up to date and compliant.
And so, I guess, what can we say, but let's spill the tea, Nyleen. And you know what? Well, let's say if you are listening from Idaho and we've gotten anything wrong, remember, we're researching, we're checking multiple sources. But if you have a better story, if you know more, you do. So you have to call us, text us, what else? Comment. What else, Nyleen? What else do they do?
Yeah, let us know. Direct message. We're on Facebook, Instagram, all the things. And we love to hear from you guys.
Before we even talk about scandals of politics, because that's, your wheelhouse, we have to really talk about the workforce crisis that is happening out there. I mean, because Idaho has one of the most severe physician shortages in the country, and I never knew that. I never knew Idaho. Did you?
No. I mean, you would think, we just talked about Hawaii and Alaska, but I guess somebody always wants to go there and nobody really thinks about Idaho. I don't know.
I might go there because, I hear they have beautiful sunflowers. They have sunflowers in Idaho? Or is it Kansas? Maybe, I don't know. We're going to find out on the Spilling the Tea Across America. But really, according to the UW Department of Family Medicine Physicians Workforce Analysis, which I think Idaho ranks 50th, y'all, in the nation for primary care providers out of 50 states.
That's crazy. So that means that the state is literally at the bottom of the national rankings for access to primary care providers. I can only imagine what the specialists look like.
And you can't live there if you can't find a doctor, Nyleen.
True.
Well, I guess according to the same workforce data, Idaho has roughly 174 physicians, y'all, per 100,000 residents. And this is coming from 2021.
That's an appointment every how many years?
100,000. So could you imagine, y'all? They are working their tail off for these physicians. I mean, for comparison, many states, y'all, they exceed about 250 physicians per 100,000 residents. And so, y'all, they haven't even hit 200. They're at 174 providers, physicians for 100,000 residents. I mean, that is definitely shortage.
Well, and when we narrow that and specifically just look at primary care, it becomes even more concerning because according to that workforce data you showed me, Idaho has only 64 primary care physicians per 100,000. So that 174 included all kinds of doctors.
Oh, so that was even the specialty.
Yes. So when you're looking at primary care, it's down to 64.
Y'all, how are y'all seeing people out there? If you're a resident in Idaho and you're listening to us, please comment and tell us, how long does it take for you all to see a doctor? Tell us. We want to know. I mean, Nyleen, it just seems like, combined that with the population growth, because I hear people are moving out there. According to state demographic data, Idaho's population has now surpassed 1.93 million residents. And this is as of 2024. And when I'm saying 1.93, That's a lot of residents, but not a lot of doctors.
Right.
What are y'all thinking? Even in between, 2023 and 2024 alone, the state added more than, I'd say, 150,000 residents, representing an 8.2% population increase.
That's crazy. So the population is growing, and apparently rapidly, but the physician workforce isn't keeping up with the same rate. It's almost like gas prices, We can't keep up. Our incomes are not going up at the same rate as the gas prices. It's kind of a problem.
Honey, I done paid so much for a half a tank of gallon today. I said, oh, Lord. But I mean, really, when we're looking at it, according to the workforce reports, Idaho has approximately about 3,180 physicians providing direct patient care as of recent force counts. And so when we're looking at it, the shortage is just...
So that means that each one of those doctors is responsible. So those doctors are responsible for caring for almost 2 million people. That's crazy.
They're tired. They're tired.